When you want to get the accurate information about the future of health and health insurance, just watch the Robin Harris Podcast Show every Thursday, 10 a.m. Arizona time at cellphoneradio.org or dial 408-418-5050 and enter the access code 81810#. It's an invigorating show where Robin brings you experts in the field of health and health insurance. The audience can view the show and ask questions of her guests in real time. That's the Robin Harris Podcast Show every Thursday, 10 a.m. Arizona time at cellphoneradio.org or dial 408-418-5050 and enter the access code 81810#. What's in your health insurance plan?
Welcome to the Robin Harris Show, Health and Health Insurance. I am so excited to be here today, and we are going to have a great show. I have a wonderful guest. Her name is Denise Haney. She's with ConnecYourCare. We're going to talk about something a little more serious, and that is compliance, COBRA compliance, and it's going to be very interesting. If you have a business, you really want to stay tuned to this one. If you have employees, employee group plan, you definitely got to be here. And if you are an employee on a group plan, you would like to know what those rules are too. So thank you so much for being here today. And for those of you that don't know who I am, tuning in for the first time, my name is Robin Harris, and I own a brokerage, a health insurance brokerage called Robin Harris Advisors, and we're heavy on the advice. We offer everything under the health insurance umbrella, and that could be a family plan, a group plan, or let's say dental, vision, disability, and even pet insurance. So we have it all. I had a very, very good day. It's been an interesting week. I mean, a lot's going on, as we all know, if you're keeping up in the news, unless you're up in, I don't know, living somewhere in a remote area without TV, you know that a lot of things are going on in the world. So I love for me to distress. I like to go for my walks, and I went for a really nice walk today. I like to sometimes go for an extra long walk, and just distresses me. And for most of my audience, they know I have a dog, and I have a video of her I'm going to have to share maybe next week, but she's quite the character. She keeps me on my toes. But her name is Dolly. We call her Dolly Pot Roast because she's square. It's kind of funny, but she's square like a pot roast. So sorry, it makes me laugh just thinking about it. But she's really cute. I got her from the pound, and she was kind of scared in the beginning, but she rules the household now. Anyway, I took her for a walk. The birds were singing, and it was fresh air. It was in the 70s today. It's gonna, from what I saw, it's in Phoenix. That's where the show is being taped here, or it's live, is in the Phoenix metro area. And I think it's gonna be about 105 today. But in Phoenix, if you've never been here, 105 here is not 105 like in Florida. I mean, if it was 105 in Florida, I don't think anybody would be left. Because it'd be too hot and humid. Everybody would just be passed out at the hospital. So anyway, so I went for this walk. The birds were singing. The morning was beautiful, and I saw this absolutely gorgeous flower. We have these beautiful flowers in the valley, and they're called Queen of the Night. And for those of you who've never seen them before, I want to show you what they look like. That's a Queen of the Night. The flower, it's beautiful, isn't it? So the flower is about this big. And I saw whole bushes. The bushes are huge. The bushes are huge, right? And they have all these huge white flowers on them, all over. The bees are just loving it. The bees were all over them. It was wonderful. So I got home and gave my Dolly a treat. She loves her treats. And then I made my green drink. And I have my green drink in the morning. And in my green drink, I have almond milk, and so I put some raw coconut in there because that's good. It's an antifungal. I put my green in there, spinach or kale. And then I put some fruit. I put something in there called black gold. One of my sponsors carries that. It's called black gold, and it's good for your intestines, healthy flora. And then I also put in there diatomaceous earth, right? I put some DE. Got to keep the gut good. You know, if you remember, Margarita Venegas was here, and she talked about that. You know, the colon and keeping the colon clean and makes your whole body healthy. It's your second brain, right? And then the other thing I put in there is what's called structured water. Now, I want to talk a little bit about structured water today. Now, my first guest that I ever had is a very close friend of mine. Her name is Carrie Gray. Carrie, if you're listening, good morning. Carrie, she is very versed in structured water. She's really studied it, and she's the one who got me understanding what structured water is. And it's actually water that travels through the earth. So water travels through the earth, right? It comes in contact with natural bodies like rocks, waterfalls, you know, like a stream coming down. It becomes symmetrically structured in a sturdy, elaborate geometric shape. So if you look at structured water under a microscope, it looks like a snowflake, right? It looks like a beautiful geometric pattern. It's gorgeous. And what happens when it comes through the rocks and the waterfalls, it neutralizes toxins. So it wipes the toxins out and increases the hydration power. So when you drink structured water, it hydrates your body more than bottled water or frankly any kind of water. It is the water that comes from the earth. So it really is the best water for us. And it enhances our ability to rejuvenate and take care of itself. And just this past 2 weeks, my husband started putting structured water on this plant. Now, this plant did not look good. I wish I had a before picture, but it didn't look that great. It had like one twig here, some flowers on it. I was going to go get some Miracle-Gro or something like that for it, or change the dirt, get more fresh dirt with Miracle-Gro. But what he did is he started using the structured water. And I'm going to show you what happened to this plant. Look at that. Isn't that amazing? It's beautiful. I mean, it's just bloomed. It looks like a brand new plant, right? But I'm going to show you what structured water looks like under the microscope. Okay? So now here is the slide. You see, this is 1 drop of water. Okay? Filtered water, spring water, and then you have your structured water. Look at the light in that structured water. Okay, that is what rejuvenates our body when we drink structured water. And so here's the stream. You can see it, right? You know, here's the stream. It's coming out of the stream. You know, it's moving along, and as it moves, it's neutralizing the toxins in the water. It's just amazing. And then, so within the last 2 weeks, it's just been less than 14 days, my husband started putting structured water on a rose bush. Now, he didn't put it on one, he just let it go. Actually, it's next to my neighbor's house, but that bush he hasn't put on, and the other bush he has put on. I want to show you the difference, and this is just within 2 weeks. Not a whole 2 weeks, just within 2 weeks. Okay, this is the bush without structured water. Okay? Oh, wrong one. Hold on. This is the one. Okay? This is the one without structured water. All right? It looks kind of scraggly. The leaves are big, but they're yellow and a little scraggly, right? And this is just within 2 weeks. And this is the one with the structured water. You see how it became greener? I mean, these are two of the same bushes. They're getting the same thing all the time. And you can see how this one within 2 weeks has become greener. That is structured water. So you can, this is a portable structured water. You know, I take this with me if I'm traveling, but you basically take the water and you put it in here. And in here, you can't see that, but in here, it almost looks like big rocks are in here, but they're not. I mean, it's device. I don't know how they make it. People are just so intelligent. But the water comes through here, and that's it. You just pour the water through here, and you put it in a glass, and you drink it, and then you have your water as structured. It's that simple. But I want to show you how to get one of these water structures. It's my sponsor is you can get this by one of my sponsors. So you go to my website, and let me just get this for you. So you go to my website, and then you go to radio podcast, and then you scroll down to Master Your Health Now, and then you go to water, and there you go. You have all these structures here. All right, like this is the one I just showed you, structured water, that you could take this wherever you go. This thing is just awesome. And then there's a video, which I really, really like. Okay, there's a video there about the power of structured water. Love it, love it. Okay, so I wanted to share that with you. Thank you for allowing me to share that with you. And then I also wanted to first of all, I want to let you know that last week we had our special guest, Dr. Dennis Cathcart. I got so much feedback from that interview because he talked about vaccines. He talked about what was in a vaccine. That was an eye-opener. And then he went in to talk about what those ingredients do to your body and your brain. A lot more going on than getting rid of sicknesses. So I really, if you haven't seen that one, you can go to cellphoneradio.org on YouTube, and you will see Dr. Cathcart's interview there under the Robin Harris Show. If you want to get in touch with Dr. Cathcart and his staff, you could go to ArizonaLifeChiropractic.com, ArizonaLifeChiropractic.com. Little bit of industry news this week. I read an article yesterday. It was a local article in KTAR that right here in Maricopa County, there's an increase of COVID-19 cases. And it said that 27% of its cases, or about 4,500, have just taken place in the past 7 days. And I think I can see that because I met 2 people today. I didn't see them, you know, I'm doing a lot of Zoom meetings and phone call meetings and things like that, but I met 2 people over the phone. 2 people that have, one right now is fighting it, and then the other one, him and his wife got it. So that's just a 1 week. So yeah, it's increasing. And then the other thing is this article on the Kaiser Family Foundation. They say that the U.S. is still seeing, the article is new coronavirus hotspots emerge across South and in California. I just want to go back to my website so you could see where I put. Okay, go to my website here, and then if you go to news, okay, here's the industry news, and then you scroll down, you will see, here's the article about the COVID-19 hotspots emerge across South and in California. So, and I have other articles too, but this is such an interesting article because it's saying that the U.S. is still seeing roughly 2,000 new cases a day. The tally ranges widely by state, from the 1 case a day on average last week in Hawaii up to 2,614 new cases in a day. But up to 2,614 new cases a day in California. So California's getting hit hard, it seems. But that's a big state too. But I don't know all the ins and outs about that. Specific areas in the Golden State have become hotspots along with certain counties in every southern state. So every southern state is getting hit in the U.S. The northeastern states of New York, New Jersey, and Massachusetts, which accounted for a quarter of all COVID-19 deaths in the U.S., are seeing a substantial slowing of new cases. And the reason why I wanted to share this article with you is because, especially for California, now California has they call it a special enrollment period, and that is available to the citizenry of California until June 30th. So if you are needing coverage for health insurance, you can go on Covered California and they can help you with that, help you get coverage. And you know what? California is a tough state. I only have one option out there because of that. They're pretty tough, but if you go to Covered California, they can absolutely help you get coverage. So we have such a special guest coming up, and her name is Denise Haney. I'm going to go to commercial, and then I'm going to do a brief video, and then you will meet Denise Haney with Covered. It's called, her company is, sorry about that, ConnecYourCare. I was saying Covered California and I'm getting it mixed up. ConnecYourCare, and she is a compliance specialist in the area of COBRA and many other group benefits. So don't go away. We'll be right back.
Wouldn't it be nice to consult an experienced lawyer whenever your family encounters a legal issue, major or minor? It's not only possible, it's affordable and convenient with the Life Events Legal Plan from Legal Shield. Our members receive services from a nationwide network of provider law firms. In the event of an emergency, whatever the day or hour, members can receive legal advice via our Emergency Access Service. Enroll today at the website listed here or contact Roger Skoll at 623-221-5496. Thank you.
Cellphoneradio.org is redefining webcasting and podcast productions. We're uniquely positioned to help you take advantage of the digital world we all live in. So if you have an idea or content for a webcast show or a podcast show, we would like to hear from you. We offer an innovative way of funding and creating outstanding webcast and podcast shows to earn income for developers and viewers. Please enjoy our current posted shows and interact with the host. Ask questions in real time and/or have one of our producers create a stunning digital advertisement spot for your company that can be inserted into our selected show schedules. Thank you.
Welcome back to the Robin Harris Show, Health Insurance. I am so excited because right here in house we have Denise Haney with ConnecYourCare.
Hi, Robin.
Hi.
How are you?
Good, Denise.
Good.
Yeah, Denise and I have known each other for it's been a couple years now, right?
Yeah.
Right?
Several years.
And Denise has helped my clients with compliance issues when it comes to their group health insurance. And what I'm going to do first is I'm going to share a brief video about COBRA. And let's just take a look at this.
If you're an HR benefits specialist, you're probably familiar with COBRA. But how familiar are you? COBRA administration can be complex. Keeping up with documentation can become a full-time job. Deadlines can slip through the cracks, making it easy to fall out of compliance and accrue big penalties. And fines aren't fine. So why not let ConnecYourCare handle COBRA for you? We help you fulfill COBRA obligations the right way, on time. For your benefits department, our compliance experts manage notices, processing, and billing. We're on top of all COBRA regulations. For employees, our user-friendly COBRA portal enables COBRA enrollment in just a few clicks. Streamline your COBRA process and stay in compliance with ConnecYourCare.
So here we are. I want to introduce Denise Haney. Denise Haney, you are the Vice President of Sales of the Southwest Territory for ConnecYourCare, one of the nation's largest benefit savings providers that offer a comprehensive solution supporting tax advantage accounts. Denise is an expert in the area of benefits compliance and has years of experience in the areas of Group 401ks, HSAs, HRAs, FSAs, COBRA, tuition, transition programs. The list goes on and on. And ERISA. Did I say ERISA?
No.
ERISA. I know you know ERISA. And then Denise is also the program director for the Greater Phoenix Association of Health Underwriters. That's a huge organization. I am so happy to have it. We have so much to talk about because, whenever we talk and we get into this, we start talking and the conversation just continues, right? It just shows you how in depth this topic is.
Absolutely.
Right? Absolutely. And the thing is that when Denise agreed to be on the show, you mentioned that we were talking about what we were going to talk about,
right? And
we were just talking about COBRA, and we just COBRA alone was so much. And we were like, I think all we're going to talk about is COBRA.
Absolutely.
Right?
It's never ending.
Never ending.
Yeah.
But a little bit about you. You're originally from Iowa, right?
Yes, originally from the Midwest, from Sioux City, Iowa. Moved to Tucson when I was quite small, so grew up in Arizona, southern Arizona. Attended the University of Arizona and then moved to California and actually graduated from Pepperdine. And came back.
I wanted to ask you. I want to ask you about Pepperdine because that's in Malibu. What was that like?
Well, it is in Malibu. However, I attended the business school, so I went to downtown Los Angeles, which wasn't as exciting, but
well, it's not. It's like a stone's throw from Malibu, right?
Yeah, exactly.
Not too shabby.
Yeah, I'll take it.
Well, I want to know what brought you to the benefits administration field.
It's funny. I kind of happened into it. I owned my own business for about 10 years, from 98 to 2006. And when we unfortunately had to shut that down due to the economy, I started looking around for a position, and I thought, I would love to be able to work with small business owners because I was a small business owner. And so I could relate to that experience. And I actually happened upon a position that was able to work with small business owners and sell 401k plans and flexible spending account plans, FSAs. And I learned that craft and then was there for with another company for about 8 years.
Excellent.
And then, so I learned that side of the business. There's really two pieces or two sides to the coin, if you will. And so I learned the financial side, but the benefit side was something that I wanted to get into. And I had a friend who worked for a company, and she actually hired me to do benefits administration sales. So
and that would get the ball going.
Yeah.
You know what? I want to move you over just a little bit more because I want to make sure everybody can see you.
Oh, that's okay.
Move over just a little bit more.
A little bit more.
Yeah.
Okay.
So what appealed? Now you've worked with some huge names in the business. So what appealed to you to work with ConnecYourCare?
It was really a company that I was looking to connect with that really had a bigger presence. As you mentioned, I've worked for a lot of large corporations, and ConnecYourCare actually does business with a number of those corporations. Some of our clients include Amazon, FedEx, Microsoft, Cox Cable.
Oh my.
So the list goes on and on, the Federal Reserve Bank of the U.S. So yeah, I was looking to affiliate with someone who was in that space where I've come from, and this was a perfect fit for me.
Oh, yeah.
I'm very excited to be here.
Talk about the growth factor for you.
Yes, yeah. So my focus is really on that small to medium-sized business owner. So anywhere from 2 employees up to 5,000. And that's a great space because, again, because of my background, I can relate to some of the things that, you know, they're going through and concerns that they have, and really let them know what they can do to be compliant, also offer some products and services that can help themselves as well as their employees, so it becomes a win-win situation.
Right, because your business was medium-sized.
Yes.
Yeah, it was medium-sized. So a medium-sized business, you're dealing with these compliance issues, so you've dealt with it yourself, and so you felt the pain.
Right. And to be in a position where you're having to be concerned about that, and how am I going to take care of that when this is my core business? This is my strength that I know and love and, you know, want to nurture and get out to the public, but there's all these things behind it that you need to take care of regarding employees and, you know, things like that I can share with them.
Right, because when someone comes to me and they say I want to start having a group plan. Mm-hmm. It's great. They want the benefits of a group plan, but they don't realize there's now they're stepping into compliance.
Right. I call it jumping into the pool.
And it depends on, is it cold or hot, right?
Sink or swim. Yeah, we throw them
on. More like sink or swim. Yeah. That's so true. Exactly. And you know, you've been in the benefits before Affordable Care Act. Mm-hmm. And how have you seen the Affordable Care Act affect benefits in general?
How long do you have?
Well,
it's a long story.
Yeah.
But what I've seen is now that the government has access to that information and the reporting that has to be done by these employers about group benefits, it's been a huge game changer for not only the employers, but for the health plans, so that they have to report, you know, types of coverage, who has coverage. There's all sorts of, you know, are they full-time, are they part-time, are they, you know, how do we determine if a part-time employee is qualified for benefits, things like that. So that's opened up a whole can of worms, if you will, for employers, again, saying, you know, I've been in business because I have a product or service that I want to, you know, let the public enjoy and take advantage of, but now I've got all these things behind that in offering group benefits. So there's all sorts of things that have changed.
So is this what I'm hearing from you, Denise, that before Affordable Care Act there was compliance, of course,
right,
but now the compliance has heightened?
Correct.
Okay.
Yeah, it's really stepped up, especially for those groups. Initially it was just 100 employee companies, size companies and above, but then it dropped down to 50 employees and above. So that was something that, you know, I think a lot of people thought, well, as long as I stay under 100 employees, I won't have to worry about this, but then they lowered it. So now the reporting requirements, everything that the government is requiring of those employers is for size, you know, group size 50 employees or more.
Okay. So, and there's so many different aspects of compliance, and the one we're going to, because there's so much, and that's why, you know, for you in the audience, if you have a business, it's I know for myself, if there's something I could farm out, I am farming it out. I can't imagine doing compliance. Yeah. Oh my gosh.
Can't be an expert at everything.
No. So I mean that way, and you're going to find out from this interview why having a professional that knows the ins and outs of this is so important. So what does the word, let's just start from the basics, because, you know, we have to assume that our audience doesn't know anything about COBRA. Mm-hmm. So what does the word COBRA stand for?
Right. It actually stands for Consolidated Omnibus Budget Reconciliation Act. It was passed in 1985. That's a mouthful.
I know.
It was actually passed in 1985, and that's the act that they refer to. However, it did not go into effect until 1986. What it means is that any employer and we're talking 20 or more employees. This is a federal law, so 20 plus employees, and we'll talk about how that, because it's not just full-time employees, it's also part-time, et cetera. If the employer is offering a group health care plan, that they are required to offer COBRA or continuation of coverage to any employees that were covered under their group health care plan if they have a qualifying event that causes them to lose that coverage. Now, I've thrown out all sorts of words here, and we can talk about what each of those means, but it also includes anybody who's covered under that plan besides the employee. So as you know, a spouse, dependents, things like that. So that COBRA law is covering that employee plus anyone that's covered under their health insurance benefits.
Yeah, because COBRA's really, I have gotten, since this COVID-19 thing, I've gotten a lot of calls about COBRA.
Right.
People that have lost their job and they're trying to make the decision, do I keep the COBRA, should I go on something else to save money and things like that. We're going to talk about costs. But, I mean, if you're going, if it means a continuation of group coverage.
Right.
Okay, that's basically what it means.
Yeah.
And if you, for instance, I'm in the middle of cancer treatment, I don't want to lose my coverage.
Absolutely.
Oh, that would be devastating.
Or if you're on, specialty drugs or anything like that, you need to make a decision. Is that something that, only is covered by my group health care plan, or can I purchase those outright, elsewhere? So all sorts of decisions need to be made when an employee is approaching, a qualifying event.
That's right.
And we can talk about those. There's actually 7 of them.
So, does a group company, and you talked about there's a federal and there's a state regulation.
Correct.
When does the state regulation come into play? When does the federal regulation come into play?
Right. Great question. So the state comes into play if an employer has 19 or less employees and is offering group health care coverage fully insured. It's a fully insured group health plan. Okay, and I know you know the difference and can explain what the difference is.
What about the self-funded though?
Self-funded right now is not covered under the state of Arizona requirement.
Okay.
Yeah, it's referred to as a mini COBRA law, so M-I-N-I, little COBRA law, and right now they're excluding those self-insured plans.
Well, self-funded, when you hear the term self-funded and level-funded, they're the same thing. And I know in the contract, because I put these contracts together, on the contract it will say, do you want to, if it's a smaller group, do you want to add the COBRA benefit? And usually the TPA attached to that usually does it. But a TPA like your company is not doing that right now because it's not required. Am I right on that?
No, we are doing that for some employers. It just depends on what state they're in. So, and different states have different laws.
Oh, they sure do.
Yeah.
Oh my.
So that's a whole nother
conversation. Thing. So, but you said there's also the federal.
Correct.
Where does that come in?
Federal kicks in when you have 20 or more employees, and those you need to look at full-time employees as well as part-time employees. So there's no differentiator when it comes to the federal government. They're saying full-time employee counts as an employee, part-time employees count as an employee. Now, they may count as half an employee, but they still need to be factored in there.
I know that we talked about this. Okay. Because of this whole thing of people being furloughed, people going part-time, and I never say I know it all, because I know I don't. There's so much to this whole industry of health insurance and compliance.
I know. It's like a maze.
I did not know that you could get COBRA if you go to part-time.
Yes. So that's one of the qualifying events. There's, as I mentioned, there's 7 of them.
Yeah,
and
let's go over those.
We're going to talk about those. I'll just refer to them here to make sure I cover everything. So obviously termination of employment, whether that's voluntary, meaning I terminate, I leave the company myself, or if it's involuntary. So my position goes away, or I'm fired, or whatever. So voluntary and involuntary termination of employment, reduction of hours, like you talked about. So I'm working for a company, I'm working 40 hours a week, and then maybe something happens in my family that I have to reduce my hours.
Right.
And so that would qualify me for COBRA. Or if my employer comes to me and says, Denise, we're going to change this position description, and so we're going to actually make it a part-time job. That would also qualify me for COBRA, whether it's my choice or the employer's choice. So that's a RIH, or reduction in hours. Divorce or legal separation, death of a covered employee, dependent children, ceasing to be a dependent under the plan. So that could be they age out, or something else happens. Entitlement to Medicare. That's a biggie, because in the boomer generation, which is, front and center right now, a lot of people now are entitled to Medicare. Doesn't mean they're enrolled, but they're entitled to it. And then if the employer files bankruptcy and the plan ends, it goes away. So that's considered a qualifying event.
And I know for you out there who is saying, wow, this is so much to digest, what I really like about your company is you have a free academy.
Yes.
For all of these benefits.
We do. So we have a COBRA Academy, which you can access via our website, ConnecYourCare.com.
Okay.
And then we also have some other tools and things that can help employers understand COBRA. We're actually coming out next week. We're launching we have a dummies series, kind of the Cliff Notes,
right,
if you will. And we are launching our COBRA for Dummies ebook. So they can go to our site, register for that, and then download it. So lots of tools, videos, they can chat live with us. I mean, all sorts of things that they can access.
And can you give your phone number real
Sure.
quick? Because I would
Sure.
I would love for if anybody's in the Arizona or in the Southwest region to give you a call directly.
Yeah, absolutely. It's 480-487-1644.
There you go. Okay. And at the end, we'll not Denise's contact information. One of the things is not reporting, because I was on the other side and I saw how a lot of times companies are so late in sending out COBRA notices.
Right.
I've seen it down to the end of the 60 days. And then the employees, I got to pay 2 months of going into 3 months of premium.
Yes.
So can you talk about that whole reporting thing?
Yeah.
I mean, or sending out the packets?
Right. So an employer, when an employee has a qualifying event, one of those 7 that I just mentioned, the employer then is required to issue, and they have over 20 employees, they're required to issue a COBRA packet. And that COBRA packet is telling the employee, here's what your cost will be to continue these benefits that you've been enrolled in, and also gives them the timing of everything. The employer is officially required to get that into that former employee's hands by 14 days after their termination date or their final day worked, last day worked. So it's a very short window. The great thing about working with an administrator like us is it gives the employer more time. They actually have up to 30 days to notify us of the employee's, qualifying event. So it gives them a lot more leeway, and that's why a lot of employers choose to work with administrators like ConnecYourCare, so that they don't have to worry about, okay, I've got to get this information out to this employee, and there's very specific rules on what that needs to include in that notice. And then once the employee receives the notice, they have, from the date they receive it, they have 60 days to elect or to decide, do I want to continue paying for my benefits? Now at this point, they're probably opening up this letter, Robin, and having sticker shock.
Oh, of course.
Okay, because when they were with the
1,700 family.
Yeah, when they were with the employed, usually the employer is picking up anywhere from 50% on up.
Mm-hmm.
So now they're looking at this bill. It could be, covering their whole family. Could be $2,000 a month, $2,500, whatever. And, for medical, dental, vision, and they experience sticker shock, and they're like, wow, I don't know if I can afford this. So they have 60 days to decide. From the date they decide, they say, yes, I want to elect COBRA. They have another 45 days to actually make that payment. So as you mentioned, if you track all this, now they're up to about the third month of saying, hey, I want COBRA. Yes, I'm going to pay this. And now they have to catch those months up.
Yeah, they do.
So it's not like they can just say, yeah, let's start it this month. They have to backtrack, so there's continuation of coverage from the date they left till present.
Yeah, and that ex-employee has to work fast because they
Yes.
only have, if they want to go on, let's say they want to go on Marketplace, they only
Right.
have 60 days
Yeah.
for that special enrollment
Yeah.
period.
And that's what's great about ConnecYourCare is we actually offer that as a service to employers and employees, former employees, where we will help them, shop the marketplace, and now they can make an intelligent, informed decision. Do I want to continue COBRA, continue my benefits, or do I want to go out to the marketplace
That's
and see
right.
what's out there?
Yeah, and in some cases they might not qualify, I don't like to use that word. They might, another plan might be available to them because that's one of the things I do.
Right.
It's like a transitional type of enrollment. But
Yeah.
I want to talk about the fines. What about the fines? Okay,
Yes.
I hear I'm doing it in-house. I'm not using a company like yours. I'm scrambling. I'm an HR person, or maybe I'm just doing the payroll. What happens to me as a business owner if I don't get all this done on time?
So number one, I always say the biggest exposure is your employee population, because obviously they see it, or they feel it. Oh, I terminated, I left, and you didn't offer me COBRA. Why is that? I was on your plan and I want to continue and I never got anything from you. So that's a big red flag. There's also penalties from the government if they're in an audit situation, and the enforcement agency for this is the Department of Labor, the IRS, and the Treasury. So there's all sorts of things that come into play when it comes to fines, fees, and penalties. Right now they can charge up to $110 per day per employee, and they can, if they want to be really nasty, they can go back until the date that plan actually started if you never offered COBRA.
Where's my calculator? So you're saying
So-
$110 per day per employee
Yeah.
if there's 100 employees.
Yeah, it's significant. So
I mean, during the course of a year, you let go 50 people.
right. Or just even, a couple. It looks, they can trace it back to times the number of employees.
And that's only one fine.
That's only
Because
one
you
fine.
said the Department of Treasury is involved in this too?
Well, they are. There's an excise tax and things like that. And then not to mention a possible civil lawsuit by a former employee.
Of
Because
course.
I didn't get offered COBRA. There's actually a case not too long ago that was awarded $1.3 million. It was a class action lawsuit by a number of employees brought against this employer because what they were doing is they were not offering COBRA to their former employees unless they asked about it, which is like,
Where's that in the
whoa, yeah.
contract?
Yes. So
I'm
it is-
sorry, I'm just being bad. Where's that in the contract?
So it's it's nothing to mess around with, as I always say to employers. I share it's kind of like driving down the freeway. Okay, so I drove on 2 freeways today to get here to the studio, and could I go 100 miles an hour? Absolutely. Could I do that and not have my license on me or no car insurance? Absolutely, I can do that. Now, what are the ramifications if I get caught? So I always tell employers, it's kind of like insurance for your health insurance.
It
We
is.
want to make sure that you're protected as an employer and doing all the things that you're supposed to do, dotting the I's, crossing the T's, but that's where we step in and come alongside you and say, all we need you to tell us is who's on your roster of employees. Anytime you hire somebody, anytime someone has a qualifying event, you communicate that to us, and we will make sure that we keep you compliant.
So how's the process when somebody wants to work with you? Before I go into that, as far as the COBRA premium, how is that? I know how it's calculated, but for our audience, how's that calculated?
So it depends on the type of qualifying event, but for the most part, it's the full premium that the employee and the employer were paying combined. So that's, let's say the employer was picking up $500, the employee was paying $500. That full premium would be $1,000 plus a 2% admin fee on top of that. That is the employee's sole responsibility. Now, the employer can have the option of saying, maybe I'll pay for COBRA for, X number of months. They often do that for level of management, employees, supervisors, etc. So that's an option. But for the most part, it's completely that employee's responsibility to make that full payment. And in our situation, they make it to us. We act as the mediator, the go-between. We collect that payment from the former employee, so that employer doesn't have to bother with that. No matter if you leave on good terms or not, it's often difficult to deal with, a former employee. So we collect that money, we remit that, we keep the 2% because we're handling that, and we remit the money, the full premium amount, the $1,000 in this case, to that employer, and then they pay the insurance company, the insurance carriers.
Yeah, that's pretty complicated there. That's why it's just so worthwhile working with a company like yours. And the other a lot of people don't realize that they can choose the dental and the vision only. They don't have to get the medical, right?
Absolutely. So once they get that COBRA letter or COBRA packet, they look and they say, okay, I was enrolled in medical, dental, vision. I was enrolled for my whole family. Maybe that employee says, you know what, I just want to cover myself and my spouse and my kids for medical only. I don't want to do the dental and vision. We'll figure out another way to handle that. Or I don't want to cover the medical. We'll go out to the marketplace, see what else is out there, and take that. And I just want to continue the dental and vision. So they absolutely have the option to do that.
Okay. And because you have the needs of a small group under 50 are the needs of the group of 5,000, but you deal with both of those.
Right.
What are the different needs that you've seen? I mean, you're in the whole. Well, you've been in many different states working, but right now you're in with ConnecYourCare. You're with the Southwest. What are some of the needs that you see that are different, 50 or 5,000?
It really just depends on their industry. Do they have a lot of high turnover, things like that? I've worked with car dealerships where they have a high rate of turnover, to businesses where, the employees have been there for a number of years. So it's really dependent on that employer, not so much, their size company, but their rate of turnover and things that they need. The federal law is, everywhere and covers all states the same. So it's really up to that employer to decide, hey, is this something I can handle in-house? I will tell you an example of a company that had 900 employees here in Arizona. They were handling their COBRA tracking on an Excel spreadsheet.
Ew.
And I point blank asked the payroll person who was handling that, I said, do you think you've ever missed anyone? Ever missed getting a notice out to someone?
That's a good
and
question.
they were in a high turnover industry, and she said, absolutely, I know I have. So that's very
and that
scary.
would have been the $110 a day
per employee.
And does that
per day per employee.
Does that also include once they've already found another job? Are they still being fined? What does that mean?
Well, no. If the employee finds another job and has coverage there, then no. That fine is really on the employer. It's not on the employees.
Right.
So it's on the employer. So the onus is on that employer. They are often referred to as the plan sponsor. And so they are completely responsible for making sure all those things are happening. And not only that, there's notices that need to go out when somebody is hired. It's actually a COBRA initial rights notice.
Oh.
We handle all that. I know that's another whole situation.
Where have I been?
So that needs to go out and be in the hands of any covered employee at least 90 days from the date that they were hired. So that is another item that we handle for employers.
So, okay, what if somebody says, well, I only have 10 employees and half of them are my brothers and cousins and, you know, they'll never sue me or anything like that. What would you say to that person? Because I see that.
Yeah, I understand. I always share with employers it only takes one. You know, it only takes one person to trigger something that, again, they can bring a civil lawsuit against that employer if they're not offered what they're supposed to be offered. And unfortunately, sometimes our family members or friends are the ones that turn on us.
I could see that. Well, I mean, if I have 100, if I find myself, my wife, say I'm a husband, I see my wife is sick,
right,
and the money's not coming in, I'm going to be looking for money.
Absolutely.
From somewhere.
Yeah, absolutely. So I always say, again, insurance for your health insurance, protect yourself. Nobody looks out for that business owner, and that's what we're here to do, is to make sure they have a hedge of protection around themselves and are doing all the things that they're supposed to be doing and doing them right and correctly and on time.
So what about, I want to talk about your process. Now here I come to you, my business is, I don't know, super florist. I bring florists to you, to your home, and I have, I don't know, I can make something up. I have 75 employees as an example. What's the process? I call you up, Denise Haney, and I say, I would like to know more about, I would like to know how you can help me.
Sure, absolutely. So we would share our resources with you, obviously, talk about your business, talk about what the turnover is like, what your hiring process is like, the waiting period for your benefits. So really get into your business and find out what that's all about, but then also demo our product so you can see exactly what our screens would look like when you log in to log a new hire or a terminated employee or someone who's, you know, unfortunately passed away, anything like that. That's how you will communicate with us. So we'll demo that product. We actually then move on to, if you decide to choose ConnecYourCare, we will do an implementation where you're handheld through the process. We'll make sure everything's set up correctly for you. And then from there, you actually have a client service person that you will be assigned to, that you can talk with an actual live person. You'll have their email address, their phone number. So if you have any questions as an employer going forward, you have a connection at ConnecYourCare.
All right. And then what other services do you offer?
We offer not only the COBRA compliance, but ERISA, and also your what we call pre-tax products, or they're called consumer directed healthcare products like flexible spending account, health savings account, health reimbursement arrangement, commuter benefits. So the list goes on.
What is a commuter benefit?
So that's if somebody has transit or parking that they need to pay for.
Oh, okay.
So like a bus
Living
pass.
in New York.
Right. Yeah, bus pass, subway. It's huge back east, obviously, not
it
as
is.
prevalent out here. But we just worked with a company in New Mexico, and they have transit passes, so bus passes, and then the people who drive in have to pay for parking, so they're reimbursing for that. So we do all that on a card. We can stack things on this card so that employees just have one card to use for multiple different products.
And does if somebody's working with you and they're getting this portfolio of benefits, are they getting a discount if they get multiple one? Like, how does that work?
Correct. We bundle things together. So yeah, so the more products we can bundle together, especially those pre-tax products, because it's all on one card. Easy access for the employee. They don't have to think, do I pull out this card for this and this, and I don't know which card I'm using for what, you know. So we try to make it very easy and stack everything together.
Yeah, because your company is not big on the paper, because they're so past that, right? They're all on technology.
Yeah.
It's a very easy technology,
Very
isn't
high
it?
tech, yeah, very high tech firm. In fact, our founder was Steve Case, one of the co-founders of AOL.com.
Really?
So that's why we're really a lot of high tech, but I call high touch as well. Our customer service is open 24/7, 365. So that obviously things happen,
No,
it's never during 8 to 5.
What happens is the HR person wakes up in the middle of the night.
Getting a phone call. Yeah. So don't call him or her. Call ConnecYourCare.
And she's panicking about
Yeah.
something.
Yeah. So.
Yeah, that's good.
Yeah.
That's good.
And it's great because, a lot of small business owners aren't used to that and they don't know what to do. They're busy running their own business and they're not an expert in COBRA or flexible spending accounts or health savings accounts. So that's why we encourage those participants to call us and let us help them. And that helps the employer not to have to be, an expert at everything, as I say, jack of all trades,
Yeah.
master of none.
Well, that's exactly what happens if you're
Right.
doing everything.
Right.
So, so are you in all 50 states?
We are.
Really?
We are, yes.
And then Washington, D.C., of course, and
Yeah.
Puerto Rico?
Yes.
Really?
Yes. Yeah. So we cover all 50 states and any, U.S.
It's
I don't
great.
know what you call them. Anyway.
You're doing it all.
Yeah. Yeah. So
Well, this is wonderful. I mean, I think what you brought here today, Denise, is really valuable
thank
information.
you. Thank you. I hope so. I
Yeah.
hope it helps employers at least think about it. And if nothing else, contact me, get the information so that you can decide if you want to try to tackle this yourself or outsource it to someone who's an expert at it and does it every day and keeps up on the laws and all the regulations that are changing. When, COVID happened, there's reasons to have employees offered COBRA that maybe you didn't think about or you didn't even do that.
I think
So.
some laws are going to be changing.
Yes.
From this whole thing.
So too.
And the other thing is that ConnecYourCare has this fabulous academy. I utilize the training myself, even though I don't sell any of these products.
Right.
And I send them right over to everybody right over to Denise. But it's really good to, if you're a business owner, to understand the compliance issues related to health insurance.
Absolutely.
So,
and they can download that from our site, and I recommend that. In fact, we have a number
Good.
of employers that require employees to, go through these academy series so they can understand how everything works.
that's wonderful.
Yeah.
Denise, how can our audience get in touch with you again, please?
Sure. You can contact me at 480-487-1644 or Denise, DENISE, Haney, HANEY, at ConnecYourCare.com.
And also go to ConnecYourCare.com
Yes.
to even see those fantastic training right there. Denise, this was so informative, educational,
Thanks.
and needed today. Yes. Thank you so much for coming on to the show. I really appreciate it.
You're welcome. Thank you for having me. Make it a great day.
Welcome to MyLifeFunding.com, an innovative way to earn a residual income for life. Here's how it works. Advertise your business or skills on our platform for $39 per month, while inviting others to do the same and earn $30 of the advertisement fees collected from those you've invited to advertise on MyLifeFunding.com every month. We don't utilize advertising media reps. That's because our advertising clients are the sales force that are afforded the opportunity to earn the sales commissions from the advertising dollars generated on this mobile directory. When you activate an advertising spot with us, you will be assigned your own independent sales rep promotion code that you'll use to invite others to advertise on MyLifeFunding.com. This strategically is done so that you can consistently earn a huge portion of the advertising dollars collected every month through your efforts. So go ahead, enter the promotion code provided to you and purchase your advertisement spot. Once you are a client, your business profile and skills will be uploaded in 48 hours. You will be notified by phone to complete the process. MyLifeFunding.com, your residual income business directory for now and the future.
Studio8181.com is a talent development and management company that owns its recording studio and video production center located in Peoria, Arizona. Share your media content, earn income, and talk to your fans all from one spot. Studio8181.com positions your content to be seen by important decision makers so you can attend exclusive auditions and or get invited to perform at venues many entertainers only dream about. The producers and engineers are determined to create new opportunities for talents, aspirants, and future stars. Don't have the money to do a soundtrack or a promotional demo video? Not a problem. You can simply request and schedule an audition. If you have the talent, we want to hear from you. Get your entertainment website and more. Email us at info@studio8181.com. Thank you.
Welcome back. Wasn't that a fantastic interview? I mean, Denise is so knowledgeable on compliance for health insurance compliance, and I'm telling you, it is very complex. That's why I don't touch it when it comes to the COBRA, the HSA, the HRAs, the FSAs, alphabet soup. That's what Denise does. And again, just go, you can give her a call. Her number is, let me get that for you. For those that missed it, is 480-487-1644. And if you are not in the Southwest region and you are maybe in New York or another state, just give Denise a call and she will get someone to help you. Okay? Well, next week we have a very special guest, and that is Jackie Shore. Jackie Shore is an RN oncology nurse, and she has a company called Patient Advocates AZ. And Jackie Shore, what she does, she's a cancer patient advocate. And so when one is diagnosed with cancer, the decisions are immense and you have to act fast, right? So what she does is she helps you, she consults with you, and she gives you the direction on what to do in that situation. She knows all the resources, she knows the doctors, she knows the facilities. And so what I've told myself personally is if I ever get cancer, I go to the doctor, the first thing I'm going to do is I'm going to call my husband, let him know, and then I'm going to call Jackie, because then she's going to give me direction on what to do first. And she is recommended, physicians recommend their patients to her. I mean, she's really something. So she's going to be here next week. And that is next Thursday, 10 o'clock Arizona time. And so what you can do is you can go to YouTube, cellphoneradio.org. You can subscribe. You can click on notifications, and you'll get notifications on the next show. And then you could also go to my website, and I want to show you that. I'm going to take you to my website. So here's my website. You could go to here. You see Denise, and there's Jackie, okay? And then if you go to learn more about the show, you could see the previous special guests. See down here, there's a whole bunch down there. And then if you want to be a special guest, you can just fill out this little form here, and we'll be happy to talk with you. The other thing is, since I have you on my website, these are my product offerings here, my insurance offerings here. You can see I offer a whole bunch of stuff. Global medical. Yeah, it's a lot of fun. Okay? And I do want to thank my producer, James Dunson. He's really phenomenal, and also want to thank our tech guru, and that is Scott Antrim. Thank you, Scott. He's always telling me what to do. Move this way, go that way, speak this way, don't go. He's funny, but he's great. He really knows what he's doing. And I want to also mention to you, if you want, I have the 10 ways to save on your health and health insurance, okay? And if you want me to mail this to you, you can go to my website, go to About Us, and you can fill out the form there, and I will have this emailed over to you, okay? The 10 ways to save on your health and health insurance. So it was a great show, wasn't it? I just loved it. I loved having Denise here. And, you know, I mention this every week, and it's really important. I started out telling you about when I went for my walk. I saw, that's my medicine. You know, going out in nature, that's my medicine. And I take my dog, I put her on the grass so she can, you know, feel the ground and get that good earth feeling. And so really, health insurance is one thing, but the best health insurance is taking care of your health. Isn't that true? That will last you a lifetime, and it costs you nothing. So the best health insurance is taking care of your health. Thank you so much for being on the Robin Harris Show, Health and Health Insurance. I look forward to seeing you next week, and you have a great day. Goodbye.
Welcome to MyLifeFunding.com, an innovative way to earn a residual income for life. Here's how it works.
When you want to get the accurate information about the future of health and health insurance, just watch the Robin Harris Podcast Show every Thursday, 10 a.m. Arizona time at cellphoneradio.org or dial 408-418-5050 and enter the access code 81810#. It's an invigorating show where Robin brings you experts in the field of health and health insurance. The audience can view the show and ask questions of her guests in real time. That's the Robin Harris Podcast Show every Thursday, 10 a.m. Arizona time at cellphoneradio.org or dial 408-418-5050 and enter the access code 81810#. What's in your health insurance plan?
Cellphoneradio.org is redefining webcasting and podcast productions. We're uniquely positioned to help you take advantage of the digital world we all live in. So if you have an idea or content for a webcast show or a podcast show, we would like to hear from you. We offer an innovative way of funding and creating outstanding webcast and podcast shows to earn income for developers and viewers. Please enjoy our current posted shows and interact with the host. Ask questions in real time and/or have one of our producers create a stunning digital advertisement spot for your company that can be inserted into our selected show schedules. Thank you.